Brazil recorded its deadliest day of the coronavirus pandemic yesterday with 881 confirmed deaths in 24 hours. Now, health experts are concerned the Latin American country could become the next major hotspot of the outbreak. Uri Friedman is here with some insight into the spike in numbers. He's a staff writer at The Atlantic, and he joins us now to talk about this. So, Uri, there are several reasons why Brazil specifically is looking at a very serious outbreak. I want you to explain to our viewers what are the wealth and racial inequalities in Brazil that may be contributing to this dramatic rise in cases.
I think the biggest is inequality. One thing we've learned about this virus is that initially it seemed like it's affecting everyone everywhere. It's an equal opportunity plague. But what we've learned is it actually affects poor people more as the virus goes on. So initially it's usually brought to countries, including in Brazil, by wealthy people who are traveling abroad. This is also happening in the United States. But then the people who are afflicted by it more later are poorer populations. And Brazil is one of the most unequal countries in the world. There's a wealthy population that brought it there through traveling, but now there are poor people, especially in what many people might know as favelas, these urban slums, who live very close together, who live day to day, many in the informal sector, and need to go out to work as street vendors or construction workers, who have to risk their health in order to earn a livelihood and go out, or they stay home but can't really social distance because a lot of these people live in small homes where there's 8 to 10 people in one room. Some don't have access to clean running water. And also many of them suffer from chronic health conditions that are kind of pre-existing conditions that can make the virus worse. So things like diabetes or high blood pressure. So I would say the biggest factor right now is the fact that Brazil is one of the most unequal countries in the world. And we are seeing this virus exploit those divisions.
And then you have President Bolsonaro. President Trump has certainly been criticized for perhaps not social distancing before, or, not wearing a mask. But President Bolsonaro is on a whole different level. He's been sort of almost denying the impact of this virus in his country. Can we talk a little bit about his behavior and whether or not that's having an impact on how people handle the coronavirus? Are they social distancing? Are they listening to the health authorities versus what the president's saying?
Yeah, this is probably the next biggest factor after inequality. I call President Bolsonaro the coronavirus denier-in-chief, or the world's leading coronavirus denier, because yes, he exhibits tendencies of what President Trump has done as well in terms of saying, the cure is worse than the disease. We shouldn't be shutting down our economy to avert public health crises. So Trump does that as well. But he goes to a whole different level. He downplays the virus as just a little bit of a flu. He says, without any evidence, that Brazilians are largely immune from this and they don't catch things like this. And one of the big things he's doing, it's not just talk. It's not just rhetoric and kind of populist denial of science and things like that. He's actually fighting local officials in Rio de Janeiro and Sao Paulo to open up the economy and to not do social distancing measures and to not, shut down the economy. And that is having a real effect. While major cities are still doing a lot of what we're seeing in the US in terms of lockdowns, he is going to the courts to battle this out all the time. And a lot of people in Brazil are following his lead, certainly his supporters on the right, but even more so everyday Brazilians who are trying to understand the signs that their president is sending and basically saying maybe we can relax social distancing. And the really key thing to know here is it's not like he's doing this at a time when Brazil's curve is going down. Brazil's curve is going up. The rates are increasing exponentially. So he is actually advocating opening up the economy and relaxing social distancing at the very same time that Brazil is still climbing its curve. And not only that, Brazil is in the southern hemisphere. So it is actually going into flu season. It's going into its winter while we're going into summer. This could be a very toxic mix of developments.
Uri, it's so difficult when you read stories like yours, the reporting that you do, because you see this happening in a lot of other countries that are even more poverty-stricken than Brazil. For example, in Haiti or in parts of Africa, where there are reports that the people that they're talking to, even health professionals who are talking to, for example, Haitians, they say, look, I have to choose between starving to death or dying of the coronavirus, because I need to go to the market. I need to sell what, meager agriculture I have. This is the only way for my family to survive. And it's a really, I know sometimes here in the U.S. we think about, can I get back to work versus, getting sick with COVID-19. But in a lot of parts of the world, you're talking about really, this is life or death on a real scale for so many millions of people around the world. And so when Bolsonaro thinks about this, is that factor in at all, or is it just about preventing an economic collapse in the country?
I think part of it is self-interested. I mean, he doesn't want to be blamed for an economic collapse. Brazil is just coming out of a recession, so he doesn't want to be blamed for another one. But part of it, there is real truth to Bolsonaro's argument, because as one Brazil expert put it to me, street vendors can't work from home, and 40% of the Brazilian population works in the informal sector. So this is a real threat, and recessions kill people too. And, a lot of poor Brazilians are faced with a really impossible choice, which is, do I risk my livelihood to protect my health, or do I risk my health to protect my livelihood? Because a lot of them can't work from home. They have to go out to earn their living. I think a lot of poor countries are going to be facing this, and certainly poor countries in Brazil, a lot of countries in Africa that may, be facing the next wave of this crisis. I think the most important thing there is for governments to be competent and effective in terms of providing economic relief in order to tide people over until this crisis subsides. Because listen, in the end of the day, yes, people need to work, but if you don't have a healthy population, you can't have an economically productive population. So the coronavirus needs to be stemmed. The question is, can governments do more in terms of economic relief to help these people? And in Brazil, for example, they actually have a system where they're trying to give people around $100 a month. But I spoke to some human rights people there in Brazil who are saying that millions of Brazilians haven't been able to access this. You're supposed to download an app. Some people don't have internet access. Some people's cases have been pending for months. So that's an example where if the government was more effective, they could really provide these people with the relief they need to get them through this crisis.
Yeah, and if you don't have healthy people and you depend on tourism dollars, chances are you're not going to be getting them to come visit your country either. So it all starts with, containing the virus first and foremost. Uri Friedman, great conversation. Thank you so much.
Thanks so much for having me on.